Can I say something on
Please.
the ethical and moral aspect
Yes,
of it,
please. Yes.
if you don't mind? So when my son, eldest son, he is now doing computer and maths. He had been telling us since the last 5 years that he was going to do medicine. Okay? And being doctors, we would expect, okay, fine, acha hai, bacha doctor ban raha hai. And he passed his UCAS, and he got a interview call from the Leeds University. And this is like, we have this interview in 2 weeks' time, and he'll probably get his seat and he'll go to medicine. And he says, Mama, mujhe doctor nahi banna hai. And before this, I had already counseled him. I had counseled him saying that being a doctor is putting your patient in front of you. That is what a doctor needs to do. You don't exist. Your patient exists for you. So if a person cannot put a patient in front of yourself, you're deficient in what you're doing. At all times, you have to think of what it's going to do for your patients. And many times in this profession, I told my son this when he was trying to become a doctor. I said to him, look, beta, we are very successful the way you see us now. We have, have enough patients, no name and money and everything. So looking at this, it looks like a very glamorous profession. Achha hai doctor, bahut kamate hai and all that. I said, but there are times this profession might not give you anything, not even name, not even money, anything. But one thing this profession gives you every day, every minute, is the satisfaction of having done something for other person. That satisfaction, nobody can take it away from you. There are patients who will come and say thank you, patients who will not say thank you. But that is felt. There are some patients, when I was working in JJ Hospital in Kama, there are some patients from rural areas, they don't even know how to say thank you. But you can feel the gratitude that they have when you've done a good job. So the gratitude and that feeling of you have done something for somebody else, nobody can take it away in this profession. If you can live with that, maybe there are days when you don't have food to eat and place to stay, but the satisfaction is there. If you are happy that this is the only thing that is in life that's going to get from this profession, then go become a doctor. If you're expecting that I can only be happy with everything else as well, then not a good profession for you. So that is the reason when when he said, Mama, I don't want to become a doctor, he said, I don't think I can give all that time and, to the patients. And, it's like, I see you working so hard and I don't think I want to be doing that. I said, good, don't become a doctor. If you cannot think of, because today I'm 55 and I'm almost more than 25 years into this profession. Every day I get to work, I go to work with the same energy and enthusiasm I would go when I started my medical schooling. There is not a difference. In fact, the enthusiasm is much more than before. And I used to do this when I went to work in JJ Hospital after the UK. I went back to be in India, and I was doing an honorary post where I was not getting paid or very meager amount of pay. And I used to travel by train on a local train and go to work. And my husband used to say, "Pagal ho gayi tu, local train mein jaake udhar kar rahi hai, you're not getting anything out of it." I said, "You have no idea what I'm getting." You cannot equate everything with money and name and fame and everything.
Right.
So I get up and come to work and I feel I want to do another days of work. The day I don't feel it, I shouldn't be working. Because what I say and do is not affecting just me, it's affecting another person. So
And
I have
their families.
I have a responsibility. So if I'm not going to be fully into it and not able to do it, I shouldn't be doing it. And the other thing is, whatever treatment I tell my patients, I have a bottom line, a bottom check we do. I say, if I can do the treatment to myself, I'll say to the patient. If I'm not doing it for myself, I'm not saying it. So when the patient says, Doctor, ye karna chahiye kya, can't I do this, can't I do this? I said, if I was in there are 4 options, you can do all this is the good, bad, whatever. If I was in your position, this is what I would do for myself. Ab nahi karna, it's okay. But that much, I am hand on my heart, I can say that. And I also believe that we are, as you said, when you say noble profession, I also believe that when patients come and tell you, and I truly believe that God aapke wajah se, doctor aapke wajah se hua hai wo sab, I feel very privileged that God has given an opportunity. How many people get an opportunity every day to make another person, give another person something better? And I feel God has been very great. I mean, I'm grateful to God for giving me that opportunity, to placing me in a position to carry out His good deeds. That's what I say, that in Hindu philosophy they say, Ham nimitta matra hai. So whatever comes is coming through him and goes. And every time I operate on a patient, I always say to God, every time I do anything, I say, God, be with me today, because he's the one who makes sure that everything goes fine.
Right.
So it's not me who makes sure, and it's not me. He's given me that skill, and I'm grateful for that. So that is, I think, that much of feeling needs to be there for this profession, because there are a lot of professions. I'm not saying people should become doctors. If you don't feel like becoming a doctor, there are a lot of professions where you can make money, you can make name. You don't have to become a doctor to do that. You become a doctor because you can see other people's pain and you want to make it better. That should be the only reason. Not just doctor, I'm talking about even the nursing profession, anything that's related to healthcare. And you will only realize it when you're on the other side. Why people equate doctors to God, because they do see that God is sending the help through a person. He can't be here. So you are kind of seeing it that way.
Right.
And I've been in that situation where I'm on the other side, and I've realized why you would think of doctor as a God, the person who is doing that day for your child, for your loved ones, the right thing, and trying to get them out of that pain that they are in, no lesser than a God. That person is for you.